It's really important for people's regular eye doctor, whether it be an optometrist, an ophthalmologist, to be involved in their care as they go through the refractive surgery process. They know their patients very well. They know all the little ins and outs of their eyes, so they're very instrumental in helping us plan the patient's surgery, getting a hand on some of the preoperative measurements, and they're very instrumental in helping with the postoperative care, which is extremely important. Well, the first thing is to make sure that you're a good candidate is checking with your regular eye doctor to make sure that your prescription is within the range that can be treated. And number two, that the prescription is stable. And only your eye doctor knows that by checking what your refraction is, what your glasses and contact lens prescription is over the years, to make sure there's been little change in that. Also, the health of the eye is very important to know if that's been in good shape. So if your doctor says that your prescription's stable, your eyes are healthy, then that's the first step. Well, the consultation process itself is pretty easy, and most patients find it very informative. We do a lot of testing of what the prescription is and a lot of what we call topography tests, checking the shape of the cornea to make sure it's perfect. We also do some testing of the thickness of the cornea, and we'll do a full eye exam checking the health of the eye. After they know that they're a good candidate, if they wear contact lenses, you need to be out of your contact lenses for a period of time. Contact lenses, even if you wear soft lenses, can change the shape of the cornea, and we want the cornea to be in its normal shape to be as accurate as possible. So soft contact lens wearers need to be out of their lenses for 2 weeks, and the more rigid gas-permeable lenses, typically a minimum of 4 weeks, and sometimes that can be longer because they change the shape of the cornea more. If either their doctor or we have determined that they have some dryness of their eyes, we often will have them use some artificial teardrops while their contact lenses are out. The procedure itself is the quickest part of the whole process. We're actually in the laser suite about 15 minutes. Most of that time is us getting things ready. The actual laser times are extremely brief. The laser flap part, which is called intralaser, is about 12 seconds for each eye. And the reshaping of the cornea part for most patients varies between 10 seconds and 40 seconds. Patients will notice right away as soon as they sit up from the laser that they can see much better than they did when they walked in. But typically right away it's a little foggy, like looking through water. And that gets better throughout the day and into the next morning, and that's just part of the normal healing process of the flap. The day of surgery, we recommend not driving. The vision still is a little bit foggy, and we typically give them a little medication to relax them before surgery. So most patients feel comfortable driving the morning after surgery. I always tell everyone to expect they might have a little fuzziness around the edges as things are healing, so to have a backup for driving in case they don't feel comfortable. But I would say over 95% of people drive themselves the next day. I typically recommend that if people have the luxury of having the day after surgery off from work, it's not a bad idea, but not everybody has that luxury. So many people do go back to work the next day. It's fine to use your eyes as much as you want the day after surgery. The most important thing is being careful not to get bumped or rubbed or hit in the eye for the first several weeks. The checkups are really important. We check patients the day after surgery, a week after, 1 month, 3 months, 6 months, and 1 year. Lasik is meant to be a permanent change in the cornea, but there are a small percentage of patients who will have little changes over time that they might need a touch-up or an enhancement. And if you look at all prescription ranges, it's somewhere in the range of 5 to 6% of patients who will need that. The other thing to keep in mind is that as patients get older, we all start to develop a condition called presbyopia, which is the need for reading glasses. And the laser's not doing anything to that part of the eye that controls the reading. So reading glasses will be needed as time goes by. Yeah, so the most common reason that people aren't good candidates is prescription instability. So sometimes we'll see patients that their prescription's still changing. They might be in their late teens or early 20s, and they really need to wait until their prescription is stable. On the other end of the spectrum, some older patients, we might find things that they've developed like cataracts or glaucoma that make them not good candidates. There are some medical conditions to think about, like diabetes. Uncontrolled diabetes makes a person not a good candidate because their prescription is fluctuating.